Hi, my name is Tristen Peterson, and I am a second-year Masters of Athletic Training student here at Oklahoma State University. And this CAP project talks about the use of internal bracing within the UCL for a shorter timeline for overhead athletes. The ulnar collateral ligament is the main stabilizer for a valgus force within the elbow. For many overhead athletes, a UCL injury can be the end of an athlete's season or career. Most surgical protocols to fix the UCL, such as Tommy John surgery, can take up to 12 to 16 months until the athlete can return to play. This has led to many questions of what can be done to reduce the time it takes for overhead athletes to return to play after UCL injury. Many UCL injuries have been more prevalent within all overhead athletes. In an attempt to decrease the return to play timeline, different techniques have been used, such as UCL repair and internal bracing with UCL repair. With the use of internal bracing, there are many advantages to consider with this repair. The first would be that there would be no tendon graft from a different part of the body, and this decreases the chance of a graft site becoming more suitable for injury in the future. Also, this should provide a faster return to play timeline depending on the amount of time the athlete needs to recover. So my main clinical focus question for this CAP project was, does the use of internal bracing provide a faster recovery time for overhead athletes with a UCL injury? How I did my research for this CAP project is I did a computerized search that was done in the month of November and December, and the search terms that I used were UCL surgery and internal brace, return to play, and overhead athletes. I used many sources for this research, as seen below. I used PubMed, Scopus, Science Direct, and Sage journals. My inclusion for this CAP project was anything that used UCL repair, internal bracing, return to play timeline, and had to include overhead athletes. My exclusion criteria was anything that was not published in English, and the population that was used in the articles did not include overhead athletes. When looking at my summary chart, this talks about the 3 articles that I used to create this CAP project and how each article was used within this CAP project to support my focused clinical question. It talks about the participants that were in each study, the inclusion criteria that these studies had to include, the outcomes of these 3 studies, the results, and based on these studies, quality score, and looking at if they supported my clinical question. The clinical bottom line for my CAP project was the evidence suggests that an overhead athlete who sustained a UCL injury and can be repaired with internal bracing, it can be done instead of full reconstruction of the ligament if tissue healing allows for this. All 3 studies indicated that the use of internal bracing provided a higher percentage of return to play timeline and can be done within a shorter time frame. However, athletes were not allowed repair if there was a complete or partial avulsion of the UCL and any kind of poor tissue quality or deficiencies that were found with imaging or during the surgery. And then again, this is my references. Thank you.